Welcome to Get Healthy with Dr. Cooper live on Facebook and YouTube. And I'm your host, Dr. Cooper Dockery. Get Healthy with Dr. Cooper is a program designed to educate you, the listener, locally and globally on how to use healthy lifestyle modification to prevent, improve, and reverse chronic diseases such as diabetes, hypertension, and heart disease. This program was designed over the last 2 years, and we have been in South Texas. Consequently, I have decided to launch a more global reach. Now, the program can be seen on Channel 19, that's Televisa in South Texas, every Saturday morning at 11:30 a.m. And now with a more global outreach on Facebook and YouTube every Sunday at 6 p.m. Now, last week we were on live and we had listeners from all over the United States as well as the world. We had from the Caribbean to the continent of Africa. Thank you so much for watching our program. Continue to follow us and send us your messages, and we will return your answers. Now today, I have Dr. Hertha Daly. She is board certified in obstetrics and gynecology. And later on, you'll be hearing from Dr. Samuel Cerna, board certified in radiology. Now, the month of October in the United States is designated for Breast Cancer Awareness Month. And therefore, the program today is focused on breast cancer. Dr. Daly, welcome to the program.
Thank you, Dr. Cooper. Thank you. I'm happy to be here today to share some information with the local and global community.
Very
Thank
nice.
you.
Tell us something about yourself, Dr. Daly.
My name is Hertha Daly. I practice OBGYN in McAllen. My practice is Womankind OBGYN. I have been an obstetrician for way over, oh my gosh, 20 years or more, I would say. And I've come across, many problems. I've helped in the diagnosis of breast cancer and several other things specific to OBGYN. I'm married. I have 3 children, and I'm a grandma.
Oh, really?
Yes, yes.
At your young age, you're a grandmother.
Oh, yes. Oh,
well,
yes.
I'm a little jealous. So, yes. Dr. Daly, now breast cancer is the second leading cause of death in women, second to heart disease, and the number one cancer seen in women. Statistics shows that 1 in 8 women will be diagnosed with breast cancer in her lifetime. And in the United States, we have over 250 women that are being diagnosed yearly with breast cancer, the invasive type, and another 63,000 with the in situ localized cancer. Now, do we also see breast cancer in men? I know this is not your area, but do we have breast cancer in men as well?
Yes, definitely. We find breast cancer in men. 99% of the breast cancers found are in females, but about 1% is in males. Over 2,400 men are diagnosed annually with the disease, and 500 of them die yearly.
Right.
Most of these are related to genetic factors, et cetera, as opposed to women who can be of average risk or have other high-risk conditions.
Right. And worldwide, about 1.5 million women are diagnosed with cancer yearly, and about 500,000 of those will die. Now, we're here to empower women to protect themselves of breast cancer. Now, in the last several years, it is believed that the death from breast cancer has been on a decline. Why do you think this is so?
Well, a part of this is related to the screening. Early detection definitely is a must, and that has been facilitated by the use of mammography. Over the past few years. There are other adjunctive diagnostic techniques that are used, but in general, for women of average risk, mammography is the gold standard. And that has helped to increase detection and also overall decrease the mortality of women who have been diagnosed with breast cancer, and prevent them from progressing to higher stages.
Right. It's also believed that increased awareness also has allowed the decrease in death and healthier lifestyle as well as treatment option. Now, the focus of the show today is on risk factors. Are you at risk? Who are the ladies at risk or men that are at risk? Let us look at several risk factors. What about age? Could you tell me something there?
Yes, well, let me just say the biggest risk factor, as I mentioned, is being female, and also advancing age.
Yes,
okay,
yes.
because only 1% of breast cancer is diagnosed in men.
Right.
Age is a definite factor, and age specifically, as you advance in age, your risks increase independent of any genetics. The earlier the onset of your menses or menarche, and the later the onset of menopause, portend greater risks for breast cancer.
Okay, now, so why is this so? So early menarche, that's the early menstruation age, and late menopause. But why is this so?
There's a long interval of exposure to estrogen.
Right.
And estrogen is thought to be the causative agent that stimulates or is particular to women. Not just particular to women, because the men also have estrogen,
Right.
but that is thought to be the overexposure to continued cycles of estrogen is thought to increase the risk of breast cancer.
Anything else?
In terms of age,
Yes.
age of the birth of your first child, again, from menarche to late age of delivery of your first child is an increased risk. I mentioned the interval between menopause and menarche and menopause. And also people who don't have children are at increased risk for breast cancer, again, because of the extended period of estrogen stimulation without interruption.
Now, studies have also shown that women older than 50, 55 have increased risk of breast cancer. So the older the woman becomes, there's increased risk of many diseases, including breast cancer.
And again, the screening that we do usually starts at around 40 to 50,
Yes.
but it can extend, it's recommended to extend until 75. Women after 75 can still get breast cancer because, as I mentioned earlier, advanced age, the older the longer you live, the more your risk of getting different diseases, and breast cancer definitely is one of these diseases that increases with age.
Right. What about race? Is there anything about race? Because I know literature state that Caucasian women are at higher risk of breast cancer.
Yeah, we're not exactly sure why this is, but that has been found to be true in studies. Also, in certain ethnicities, like in Ashkenazi Jews, there is an increased risk of breast cancer, and that may be due to genetics.
Right.
Also, the different mutations in the genes.
You mentioned genetics. Why don't we talk about that particular genome that will increase? If the woman is tested to have those genes, then they're at higher risk. What are those genes?
There are certain germline related mutations. There's one called BRCA1 and also BRCA2. And there are actually a lot of other mutations that have been discovered that when we test for the genes, those don't necessarily come out as BRCA1, but they're mapping more of these genes, and these have been identified even here in the South Texas community to be the cause of breast cancer in certain families, in certain women.
Right.
Yes.
So should we motivate the ladies to be tested for genetic types, or that's not necessary?
Well, it depends on the family history.
Right.
The family history definitely is a factor. If the woman has a mother or a first-degree relative, second-degree, even third-degree relative that has had breast cancer, ovarian cancer, any pancreatic cancer, prostate cancer in the history, then these are definitely people who are at higher risk. And especially if there's been, the age, if it's less than 50 or 45 now, where this has been diagnosed, or if there are more than 2 family members, then definitely they're at higher risk for breast cancer and should be screened if screening has not already been done in the family.
Right. So that is a mother, a child, or a sister.
A sibling, yeah.
Right. It's also said that if a man and a child have been diagnosed with breast cancer, then the risk is also increased.
Again, there are two family members.
There are two family members, right, right. What about personal health history? Say, for example, somebody has a breast cancer in one breast. Is there an increased risk for having breast cancer in the other breast?
There definitely is an increased risk of having breast cancer in the other breast, and also in people who have had biopsies previously for atypical findings, atypical hyperplasia, ductal carcinoma in situ, other conditions like this. They are at increased risk for breast cancer. So they would be in the high-risk screening group as opposed to the average screen group.
Right. So we can look at the risk factors into two groups, those that are modifiable and those that are not modifiable. It's very hard for the woman to select what family they're born in, right?
Yes.
But there's certain modifiable risk, like lifestyle habits, that can also increase one risk for breast cancer. Let's look at alcohol. Now,
yeah, alcohol increases the risk of breast cancer. You know, excessive alcohol uses are even more than moderate. I mean, one glass a day of wine, I guess, is considered acceptable. But excessive alcohol intake, smoking, diet, increased BMI, or lack of exercise are also risk factors for breast cancer.
Let's talk about alcohol, because many people might be thinking out there, so what about alcohol? How much can I drink? Now, the literature reveals that if a woman drinks more than 3 alcoholic beverages a week, then the risk for breast cancer is increased by 15%. And what is a drink? 12 ounces of beer is a drink. 5 ounces of wine is a drink. And 1.5 ounces of hard liquor is a drink. So 3 or more per week will increase the risk by 15%. Now, if that person drinks daily, then there's an additional increased risk by 7 to 10%. So alcohol should be avoided or should be reduced in terms of consumption. Now, why is it then that alcoholic use increases the risk of breast cancer? What do we know about that?
I'm not sure specifically what the cause is. Maybe you.
Yeah, I can probably say so. Now, it is believed that the consumption of alcohol will increase the level of estrogen, and estrogen is the problem. High levels of estrogen in the blood will increase the growth of the cancer cells. And studies have shown that women that are diagnosed with breast cancer usually have a high level of estrogen, and women who consume alcohol will also have a high level of estrogen. Now, you mentioned increased BMI. Increased BMI, obesity and overweight will increase the risk of breast cancer, because the fat cells also produce estrogen.
Yes.
So estrogen is a problem.
Estrogen is dangerous.
It's dangerous. And as you said, you know, initially, the #1 risk factor for breast cancer is being female, right?
Yes.
Because we produce a lot of estrogen. Now, inactivity, lack of regular physical exercise, this is a modifiable risk factor. So those ladies out there, if you're not exercising, then you need to start doing so. 30 minutes a day at least will decrease your risk for breast cancer. Now, diet. It seems as though every disease that we can think of, every chronic disease, the #1 risk factor there is poor diet. Now, we're living in the United States. Why should we have a problem with poor diet? What are we eating that increase the risk for all of these diseases?
Lots of processed foods.
Processed foods.
High saturated fats.
Saturated fats.
You know, just less fruits, less vegetables, less natural, you know, more refined foods and less complex carbohydrates, etc.
That's right.
So, I mean, this is very accessible, and especially in poorer communities, this is definitely what there's a prevalence for.
Right.
So.
Right, and therefore, Get Healthy with Dr. Cooper promotes healthy lifestyle habits. Now, I have two books on the market. One is 14 Days to Amazing Health. The other is Incredibly Delicious Vegan. So if you're listening to us and you'd like to change lifestyle, you'd like to learn how to increase your fruits and vegetable or move to a more plant-based whole food diet, then get one of my books. You can find it on my website or on Amazon. Now, Dr. Daly, what are the other risk factors that we probably have not addressed?
Well, I mean, we mentioned genetics, dense breasts, maybe a risk factor, probably because the mammogram is not as sensitive when the breast tissue is dense. So a lot of times this calls for adjunctive studies and because the test probably was not well done or was inadequate, there have been increased cases of breast cancer in those situations. And patients who have dense breasts should be advised that their breasts are dense, and so we cannot, the test is not 100% reliable, and they need to have closer follow-up.
Right. So, ladies, if you're listening to us, if your doctor told you that you have dense breasts, then you need to ask for a secondary study, which could be a sonogram or a compression spot view of your mammogram. Now, another risk factor is radiation to the chest. Yes. People who probably have had lung problem and have
Hodgkin's lymphoma, situations like that where they've had ionizing radiation treatment over a period of time between 10 and 30 years. It's been found that between 10 to 30 years old, it's been found that exposure during that time can increase the risk of breast cancer, and sometimes even later. So, this is something, if you have a history of this, that's definitely something that you need to pay attention to and go in and ask for screening.
Right, right. Another risk factor, many times I have ladies coming into my office and they have mild hot flashes and they're asking for hormone replacement therapy. Now, hormone replacement therapy is indicated for how long? And why is it that we have to stop the estrogen supplement at a particular time? You want to expound on that a little bit?
Well, yes. There's synthetic hormone therapy, and there's also bioidentical hormone therapy. The synthetics, the Premarin or Estrace or some of these drugs that some of you may be familiar with, have been implicated in breast cancer. There was a study called the WHI study that was done back in the 80s that showed that people who received estrogen and progestin did have an increased risk of breast cancer, so much so that they actually had stopped that study. In patients who have had a hysterectomy and and it's indicated to use progestins if you have a uterus still, because of course that can lead to other GYN-related endometrial cancer if you're using unopposed estrogen. So it is desirable to use both if you're being treated for menopause. In people who have been hysterectomized, they get estrogen. It's actually just estrogen, and it's been shown that they have a somewhat lower risk of developing breast cancer. Right. So the estrogen replacement they usually start because of hot flashes, vaginal dryness symptoms, etc. It's recommended after that WHI study that the hormones be continued until the symptoms go away, especially the hot flashes. So whenever the hot flashes go away, then they recommend that you stop treatment. Of course, that can be a problem in some people who are still having symptoms.
Right. Yes. So the recommended duration for hormone replacement therapy is no longer for lifetime, right?
No longer for lifetime. That was initially.
Right.
With bioidentical, they have a different tape, but that's a whole other story.
Another subject.
Yes.
Okay. Yes. All right, it's Dr. Daly. Now, a lot of patients are fearful to do a mammogram, right? And I had my mammogram done recently, and I wanted to go on this program with my mammogram so that the ladies out there can see that it is not painful. It takes about there is mild compression, and it will probably last about 10 minutes to get both breasts done. So this time I'm going to show you my mammogram study that was done recently. Let's put the tape on. So this month it's Breast Cancer Awareness Month, and a lot of ladies are hesitant to get their mammography done. So I'm here at DHR Imaging Center, and I have a mammogram tech here. And she's experienced. How long have you been doing this?
Approximately 10 years.
10 years.
Yes, ma'am.
So a lot of ladies have come through you here with you.
Absolutely, yes, ma'am.
All right. What do you think is their greatest fear for not wanting to do the mammogram?
I think that probably it's two things. The first thing is they're afraid to get the mammogram because they think it's going to hurt.
Right.
Okay. The whole experience of being compressed, makes them very antsy, very nervous. And then the second thing that makes them afraid is the outcome.
That's
Okay.
right.
The results. So basically, those would be the two things that are most concerning to them.
Right, right. Well, most of my patients, or a lot of my patients will say the pain. So I want you to tell us, this is a mammography machine.
Right.
Just explain more or less what you do here if a patient walks in for the mammogram. Tell us the process.
Okay, basically, a screening mammogram is about 4 images, approximately 4 to 6, depending on how many we have to take. Everybody's a little bit different. And basically what we do is we take the breast and we position it on this machine, and we compress with a paddle here. We do very gentle, very, slowly, so the patient will kind of get the feel for it at first, and then we finish compressing, we take the picture, and the patient will be released automatically. So the patient will not be compressed the whole time, just in case anybody is concerned about that.
Right.
It's one picture at a time.
Right.
Yes.
How long does it take usually?
The whole exam?
The whole exam.
Oh, I would say about 15 minutes.
Oh, that's very
a
fast.
routine exam will be about 15 minutes. If we have to take more images, then of course it'll be anywhere from 20 to 30, just depending on the case. But a routine mammogram will take approximately 15 minutes.
Very good. So you're saying it's very easy to do, very simple.
Very, very simple. Yes, ma'am.
Well, today I'm going to do my mammogram. So I'm going to show you how simple it is. All right, so we're going to take a break. Okay. I am ready to start my mammogram. All right, let's go and see how difficult it is.
Okay, ma'am, very good. So we're going to start with the right. We're going to remove your right sleeve first. So we're going to undo the gown here. And we're going to start with the right here. And we're going to undo this side as well, okay? And just, I'm going to put some nipple markers on you. So we're going to take one of these stickers. And I'm going to put one on each breast. Any breast surgeries or biopsies?
Yes.
Okay. Is it right here? Okay, very good. Basically what we're doing here was just marking the area where you had a surgery, okay, for any scarring inside. Okay, we're going to start with the right. We're going to go ahead and stand straight right here in front of the machine, feet pointing straight, and your arms down here by your side, okay? Alright. You come towards me a little bit right there. I'm just going to bring the machine up. She's a little cold. Okay, your feet will always be pointing towards the machine, okay? I'm going to pick up the breast. We're going to give it a little pull. We're going to bring it all the way in. Right there. And just relaxing your shoulder. Very good. I'm going to start to compress. And just try to relax as much as possible. Very good. I want you to hold real still right there. Hold your breath, please. Hold your breath. Very good. Try not to move. You can breathe. One moment, please. Okay, very good. Now we're going to go on to do the next view here. We're going to step back a little bit. You're going to leave the gown like that, and we're going to just tilt the machine. We're going to give it a 45-degree angle. Okay. And again, your feet will be pointing straight ahead. Okay. We're going to raise your arm right here. Okay. I want you to scoot out it that way. Right there. Okay. And without moving your feet, you're just going to lean to the side. Drop your shoulder here and hold right there. And relaxing your shoulder down. you to hold this first right here. Let me just kind of hold it there. I want you to tilt your head back. There we go. Lots of pressure here. Here we go. Hold your breath, please. Hold your breath. One moment, please. You can breathe. Stay right there. All I'm going to do now is I'm going to move your shoulder out, right here. And I'm going to take another picture right here just to get the bottom portion of the breast, right? And tilt your head back for me. Perfect. Hold your breath, please. Hold your breath. One moment, you can breathe. Very good. We are done with the right side. Now we're going to do the left. So go ahead and let go of the machine. Okay, we're going to put this side on. And now we're going to remove this side, okay? And just hold on to the gown for me right here. I'm gonna move the machine. Go ahead and step back a little bit. Okay, so we're starting with this first view right here. Your feet pointing straight right there. We're gonna raise your arms. I want you to scoot down that way. We're doing the same thing, okay? We're gonna lean to the side, hold right here. All the way in. Perfect, right? Okay, I'm going to take this hand. I want you to go ahead and put your arm down here. Okay, and just relax. Also relax as much as possible. Do a little pull right. Okay, go ahead and hold this breast for me right here, putting your hand on it. I'm going to slide your hand a little bit more. A little bit more, all the way here. Just you're going to feel the pressure there. I'm hanging in for me. Very good. I'm going to take a picture right there. I need you to hold your breath, please. One moment, please. You can breathe. Okay, very good. Let's go ahead and step back. And now we're going to do the front view. And again, we're standing straight with your feet pointing towards the machine and your arms down by your sides. Okay. Right here. And go ahead and put this arm down here. You're going to come towards me. A little step this way. Right. And we're just going to move this first right here. Okay, I want you to relax your shoulder here as much as you can. Okay, we're going to lift the breast. We're going to give it a little pull just to make sure we have all the breast in here. All the way in. And just relax. You're going to turn your head this way. A little bit. Okay, and we're going to push it all the way in, making sure that we have all the breast in. Very good. All right, I need you to hold your breath again. Hold your breath. One moment, please. You can breathe. Okay, very good, Dr. Cooper. That's it. We're all done. All right. I'm going to have you just step this side on. And that's it.
So there you go, everyone. That's the mammogram, about 15 minutes maybe.
Approximately.
And I'm not in any pain. So I will tell you what the result is later. Thank you. Facebook friends, that's me and my mammogram. I'm very sorry I had to expose my back because I wanted to encourage you all, ladies out there, to get your mammograms done. And all the husbands that are watching us, encourage your wives to get their mammogram done. Because as we mentioned, breast cancer is the #1 cancer in women and the second leading cause of death. And you know, many women are dying, and we can reduce or prevent this disease with early detection. Now, Dr. Daly, did you think I did well there? Do you think I did well?
You did very well. My mammogram didn't go quite that well. My mammogram lasted about 45 minutes.
Oh my gosh!
Because of course I probably have dense breasts.
All right.
So they had to do different views and compression, and for me it was painful. But you know, that should not be a deterrent. It's a necessary thing that has to be done in order to maintain your health and to be proactive in maintaining good health and, you know, preventing. You know, if you have cancer, you want it to be diagnosed early. It's an ounce of prevention is better than
a pound of cure.
A pound of cure. Okay.
There you go.
Okay.
There you go. So
I see my cousin Paula is watching. Thank you for tuning in, Paula. And of course, Paula has a personal experience with breast cancer. She had bilateral mastectomy. So Paula, please tell your friends to, you know, go about getting their screening done.
Very good. And ladies, you see that both Dr. Daly and myself, we have had our mammogram this year already. Mine lasted for about 10 minutes. Dr. Daly's lasted for 45 minutes. So we left the imaging center okay, no pain at all. So, Dr. Daly, what will happen to those ladies who do not get their mammogram done? What would you suggest they do?
Well, the recommendation, and there are different consensus groups, and the ACOG, which I follow, recommends having your mammogram done at 40 and every year, or 1 to 2 years, depending. You know, there can be a discussion between the patient and the doctor about how frequent you want it done. If you haven't had it done by 50, you certainly need to get one done at 50. There are other groups that recommend starting at 50 and doing every 2 years. American Cancer Society goes along with the 40, or at least by 45, and then checking every year to 2. And then there's another consensus group that agrees with those. The United States Preventative Task Force is actually the one that's recommending 50 and above. And again, some of this is because of fears about false positives and anxiety that patients may have, because if you tell them that there's something that it may not necessarily be a bad thing, but if they have to have follow-up studies, then they get very anxious, and sometimes they don't want to follow up. So, you know, but it's very important.
In my office, I start recommending mammogram at age 40 and yearly thereafter.
That's what I do.
Right. And what are some of the signs or symptoms of breast cancer if someone refuses to get a mammogram done? What should they look out for? Any changes in the breast?
Well, it's important. I mean, the American Cancer Society and other groups have been less supportive of breast self-exams because they said it just leads to anxiety, it can have a lot of false positives, end up having more biopsies than you need to have done. However, it's important to have breast awareness.
Right.
Everyone needs to know what their breast normally feels like.
Agree.
So that if there's any change, any abnormality, you can say, this wasn't here last month, let me check it again. And if it persists, then it's important to follow that up. Many breast cancers have been diagnosed by the patient as opposed to mammogram, but you know, the self-exam is actually not as sensitive. You know, if there's something that's less than 2 millimeters, you may not feel it.
Right.
So it's important to have the screening. Most people who come in who have diagnosed with breast cancer have no symptoms. You know, they don't feel anything. Their breast may feel lumpy. Again, that goes back to breast awareness, because if you don't know what your breast normally feels like, if there's a change, you may not be aware that there's a change. But there are other signs that can occur. There's one type of breast cancer called inflammatory breast cancer, where a lot of times you come in, I mean, all of a sudden you develop redness. It may be red, it may be kind of hard. maybe kind of painful, people need to be aware if anything like that happens. It could be an insect bite. It could be something else more benign, but it's important to follow that up. But redness, discharge from the nipples, especially if it's one nipple,
Right.
bloody discharge are ominous signs.
Nipple retraction.
Nipple retraction, or there's can be a orange peel appearance, peau d'orange. Those
But
things are definitely.
what is orange peel appearance? I think the common woman doesn't know what that is.
Yeah, it's looking at the orange peel, there's kind of some dimpling that you can see there, indentation. And that, usually when you have that, the cancer has progressed further. But lumps in the breast, there are lumps that are benign, again, going back to breast awareness, but there are some things that feel different if it's not symmetrical, and you check on one side and you don't feel the same thing on the other side, and it's prominent, nodular, hard, you can't move it. Those are definitely things that you need to bring to attention of your doctor, or
Correct.
go get screening.
Correct. And ladies who have not been screened for a while, who probably have persistent back pain, should see their physician. I just had a friend who was diagnosed with breast cancer stage 4 because she was not getting her yearly mammogram, and she presented with back pain. Then when she was seen by the doctor, the cancer was already in the bone. Yeah. So ladies, do not hesitate to see your doctors. And if you do not have health insurance, then during the month of October, many institutions and facilities offer the mammogram for a decreased cost. I know here in South Texas, the various hospitals like Doctors Hospital Renaissance, even the other hospitals.
Yes,
around.
and some freestanding
and
centers.
freestanding imaging centers will offer a discounted rate for you to get your mammogram. So ladies, you do not have any excuse this year not to get your mammogram done.
And let me also speak to the group. There are some women who will feel a lump, and they know it's different, but they, because of fear of finding out what it is, decide to wait, and then 1 year goes by, second, third year goes by, the lump is still there and it's growing, and then at that point, they may decide to go get it checked out. Just don't let fear cripple you, please. You need to go and get it checked. If there's something that feels strange, you're not sure what it is, even if it's nothing, it's more important to go get it checked and to get screened than to stay and develop a highly advanced cancer lesion.
Right.
Okay?
And remember that with the advancement of medicine, we can actually highly treat breast cancer. So I have a lot of patients who have had mastectomy done 10, 30 years ago, and they're doing very well. So once you're diagnosed with breast cancer, it doesn't necessarily mean that you're going to die. Treatment are very effective at this time as we speak. And now I'm going to talk to Dr. Cerna. Dr. Cerna is a local radiologist who read my mammogram. Let's put the video on to hear what he has to say about mammogram. So here we have Dr. Cerna, a radiologist who's going to be looking at my mammogram, which I just did. Dr. Cerna, a lot of patients are hesitant to get their mammogram done. Why do you think this is so?
Well, I think part of the problem is the culture. Unfortunately, here in South Texas, many Hispanic women, including my mother, are very apprehensive about getting any type of studies, whether it's a mammogram or a pelvic exam. But it's very important down here that we do so. We have a very high incidence of breast cancer and also cervical cancer, so it's extremely important that you get those studies done as directed by your doctor.
What amount of radiation the woman is exposed to during the mammogram?
With the, that's a very good question, and that's always a big concern. But with the amount of radiation exposure, it's based on the type of equipment that you're being that you're having the studies performed with. Here at DHR, we have state-of-the-art equipment, and we have mammography units that automatically regulate the amount of radiation and exposure to the patient. And studies have shown that the amount of radiation is similar to taking a flight, let's say from here to Houston.
Very good, very good. So that's there, that image is my study, am I right?
Yes, this is your mammogram that was performed today, and luckily we have a prior mammogram that was done back in 2012. So it's extremely important and helpful for the radiologist and for the doctors to have a prior study to compare, because we're looking at changes from 1 year to the next. So here we have a study back in 2012, and we'll be able to compare it to 2017, and we're looking for any subtle changes that the mammogram will pick up.
Right. Changes like what?
We're looking for new masses, which would show up as a bright spot on the mammogram, and we do not see that on your mammogram.
Excellent.
We're also looking for subtle, small microcalcifications, which we can pick up by the mammogram. Here's an example of a very small microcalcification, benign appearing, not worrisome, but these are the type of calcifications that we're looking for. So we're looking for calcifications, we're looking for any type of masses, we're looking for skin thickening, we're looking for changes in the nipple area, such as nipple retraction, we're looking for any type of lymph nodes up in the axilla.
You know, a lot of time patients are told there's a calcification, they get very worried. Should we be worried when we're told there is a microcalcification?
Not necessarily. Microcalcifications, unfortunately, are just part of every mammogram, or most mammograms that we see, and it's just a part of aging, if you will. It's the type and description of the microcalcification that's concerning. So you can have a spectrum of benign appearing microcalcifications, which are normal. It's the more clustered microcalcifications that become a little bit more suspicious, and that will direct us to do further testing.
When do you send the patient for sonogram? A lot of time we're asked to send the patient for a breast sonogram. When do we do that?
The sonogram is a very helpful tool for breast imaging. It allows us to actually look at the soft tissues of the breast in real time. So when a patient comes in with a complaint, let's say breast pain, we'll get a diagnostic mammogram and also an ultrasound. The mammogram is essentially going to tell us whether or not there's a mass there, but the ultrasound will tell us what type of a mass. Is it solid? Is it cystic? Is it irregular? Is it benign appearing? Also in younger patients below the age of 40, if they come in with breast pain or any type of complaints, usually we want to do an ultrasound first before we expose the patient to any kind of radiation.
Very good. What if a woman has had breast reduction or implant? Do you recommend mammography or an MRI?
If a patient comes in with those type of surgeries, if they're not having any type of specific complaints, and just a regular routine mammogram, whether they've had a reduction or augmentation with implants, we would first do a mammogram. Of course, we would first do a mammogram, and then based on that, if there's any changes or anything concerning, then we might consider an MRI. Now, if a patient comes in and says they think they might have a rupture of an implant, then we'll go directly to MRI.
Very good. Dr. Cerna, is there anything else you want to tell the ladies so they can come in this month and get their mammograms done?
Yes, absolutely. So here at DHR, well, at any hospital here in South Texas, it's October, and this is breast imaging month. So we encourage you. I'm begging for you to please come on down and get your mammograms done. Not only DHR, but other hospitals are offering savings to get your mammograms to try to come in. But most importantly, we need to follow your doctor's recommendations. We need to do your yearly mammograms. We need to do your screenings, your diagnostics. It's very important that we do not waste any time because you're fearful of getting that study done. You'll come in, we'll take care of you, and we'll make sure that you get well taken care of.
Thank you so much, Dr. Cerna. Thank you so much, Dr. Cerna, for your contribution to the mammogram. And we want to thank our viewers from all over the world. We're seeing your questions. We're seeing your comments. Somebody's asking, at what age should you begin the mammogram study? And that is age 40, at least age 40. However, if you're younger than 40 years old and you have a breast lump or pain, then you need to see your doctor because you might need a mammogram or a sonogram. What do you have to say, Dr. Daly?
Yeah, less than 40, the mammograms are not as sensitive because, of course, the breasts are very dense. Yes. And a lot of times we'll do a sonogram, and if there's something that looks suspicious, then order a mammogram because, you know, the mammogram is not technically indicated if you're less than 40. But if you have a family history, definitely, and all these other factors we talked about, then, you know, definitely a mammogram will be ordered. I have a patient who was diagnosed with breast cancer in her 20s.
That's right.
So, and you know, naturally just one, I've had several. So it is not impossible to have that. And in fact, there have been in the recent past more and more people being diagnosed at a younger age. So it's very important that you pay attention, be aware, and get checked out. Thank you. Again, I saw my peeps, I can't mention you all individually, family, friends, my holy childhood high school sisters, thank you so much for tuning in. And get your mammogram and tell other people.
Very good, very good. And as you mentioned, breast cancer, nowadays we're seeing a high incidence of breast cancer in younger women. And it is shown by studies that these cancers are more aggressive. So ladies, if you're younger than 40 and you have any irregularity in your breast, please see your doctor for that to be taken care of. Anything else, Dr. Daly?
Not that I can think of offhand.
Well, you know, earlier on we mentioned risk factors, various risk factors, those that you can tweak and those that you have no control over. Lifestyle.
Also, smoking is a big one.
There you go. As Dr. Daly mentioned, smoking. Smoking, alcohol, obesity, inactivity, poor diet, a diet high in animal fats, a diet low in fruits and vegetables. These are risk factors. And for this reason, I have these books. I'm going to hold this up, 14 Days to Amazing Health. Find this book online or at my website, because this book can introduce you to a plant-based diet. And then I have some wonderful, delicious recipes in this book. Incredibly delicious vegan. It is so easy to decrease the fats and the processed foods if you know how to, and I'm here to help you with that. Now, before we go to my next segment, do you have anything you want to say, Dr. Daly?
In terms of what you can do to decrease your risk, there is multiparity. When you have a lot of children, that's been shown to decrease your risk of breast cancer. And also breastfeeding. Breastfeeding is very important.
Breastfeeding.
Yes.
Mm-hmm.
So for all you ladies out there who are hesitant about it, breastfeed.
There you go.
And the more kids you have, the more you breastfeed.
There you go.
Okay, so,
and exercise. All right.
Yes.
I have a very delicious recipe for you, so go ahead and watch. Welcome back to Get Health with Dr. Cooper Kitchen segment. Today I have a very simple but nutritious recipe for you today. I have quinoa salad. Now quinoa, it's a whole grain that has a high content of protein, fiber, and all the good nutrients. I'll also be using black bean. Beans are the poor man's protein. Lots of protein, complex carbohydrates, lots of fiber for good health. I'll also be using garbanzo bean, same properties, proteins and fiber. I'll be using corn, roasted corn. Corn is a whole grain. It has all the fiber, all the nutrients, all the protein, and all the minerals. Let us start. So 2 cups of quinoa. This quinoa is already cooked. Very easy to cook. It cooks in about 15 minutes. Then to the quinoa, I'm going to add my already cooked black beans, 2 cups. I'll add some more beans, and that's going to be my garbanzo or chickpea, another 2 cups. And to this, I'll add another grain. This is my roasted corn, 2 cups, and this will give the crunch. To that, I'm going to add my pico de gallo, which is made of cilantro, onions, pepper. So we're going to mix that in. And to that, I'll add a pinch of salt. So a pinch of salt. Then I'll add my lemon juice. I'm going to squeeze this in. And if you like more lemon, you add lemon. This gives a lot of vitamin C. Now to that, I'm going to add 2 tablespoonfuls of olive oil, extra virgin olive oil. And you always should be careful with the amount of oil that you use in your diet, because oil is processed and high in calories. So be very careful. All right, so we have our extra virgin olive oil there. And then I'm going to spice it up with my pepper here. my cayenne pepper. So let's just, add a little bit of cayenne pepper, not so much out there, okay? So we add some cayenne pepper, and we're going to mix this in. So we're going to mix this in thoroughly so we get all of our spices or flavor in. This is ready to go. Now this dish is very easy to prepare, as you have noticed. You could leave it overnight. It could be served hot or cold. This is a good one to take to work. Just pre-package this and you have a whole meal ready, filled with protein, good carbs, lots of fiber to fill you up and for you to keep feeling fuller longer, and of course your minerals and your vitamins. Now if you really want to stay healthy, to lose weight, reverse your hypertension and your diabetes, and lower your cholesterol, then you need to make this at home for yourself and your family. Now children, you notice there's a surge of diabetes and obesity right now because of the diet we eat. So parents, if you model good healthy diet, then your children will be healthy. So for more recipe or to learn how to live a long and healthy life, then join my community. Go to my website, gethealthywithdrcooper.com or .tv or cooperwellnesscenter.com. Until then, I'll see you again soon. To your health. There you go, friends. That was quinoa salad. And quinoa is a whole grain that is high in protein, good carbs, and fiber. So you have, if you were to make this salad, then you have a whole dish. You have your protein, carbohydrates, you have your vegetables, you have good fats. So don't hesitate to try something new, especially if you want to reduce your risk for breast cancer. What do you have to say, Dr. Daly?
I agree with Dr. Cooper. I have to try to go to that vegan-based diet, but I'm working on it.
Good.
But, you know, just this has been great, providing this information. And there are several questions that were asked that I just want to address. There's one that I saw a friend asking about small breasts. Small breasts are mammogramable.
Exactly.
It may hurt a little bit, probably just as bad as big breasts. Mm-hmm. But it's important, and it's actually they're easier to check because they're smaller and there's less dense tissue to go through. So it's still very important whether you have small breasts. I mean, it hurts, just get beyond the thought of the pain. It's very important that small breasts, big breasts, medium breasts all have mammograms. When the mammogram, sometimes when the results come back, people get kind of nervous. You get a letter saying, follow up with your doctor. That leads to anxiety. But a lot of times, it's just to make sure that there's nothing there. It doesn't mean that there's something bad. Mm-hmm. You know, sometimes you just need additional views, just to spread the tissue out a little bit, compress a particular area where they may see some calcification. It may just be that the tissue is packed, you know, piled on top of fibrous tissue or cystic tissue, and there's nothing there. So just don't be afraid. Just go get it done. And if there's something bad, of course, it's better earlier than later. Okay.
Right.
So just don't be scared about going for the mammogram and then going for the follow-up. I have patients who heard that they were supposed to come back and they just assume that they have cancer and they just don't come back.
Right.
But that's not proactive.
Very good. And patients who have breast cysts are usually benign. So don't get anxious and nervous that you have cancer when the doctor says you have a cyst and we have to repeat a sonogram in 3 or 6 months. We're just doing that to make sure that there are no changes in the cystic lesion. So don't hesitate. We want you to go out there, ladies, and get your mammogram done. So follow through. Age 40 and above, you need a mammogram, whether it's yearly or every 2 years. Less than 40, if you have any breast lump, any breast pain, any discharge, any nipple retraction, you must see your doctor.
Any redness.
And of course, any skin changes. And husbands, help your wife with the, to know her anatomy. So if you feel anything different in the breast, just encourage her to see her physician. Ladies, you should not be anxious for anything. You have a great and wonderful God above. He created our bodies. He is the master healer, and He will strengthen you. So if you're anxious, if you're out there and you were told you have breast cancer and you don't know what to do, keep watching us, because this month, the entire, every Sunday for this month, I will be discussing different aspects of breast cancer. I will have an oncology on the show with me. I'll also have a lifestyle doctor who will discuss with you how you can improve lifestyle and therefore decrease your risk for breast cancer. Find us online, Facebook, YouTube, or my website. And if you're in the local area of the Rio Grande Valley, you can find Dr. Daly. She has her office right here. Where's your office, Dr. Daly?
It's called Womankind OBGYN, and we're located at 1200 East Ridge Road, Suite 3 in
Right.
McAllen.
Right, and I have 3 offices here, 1 in Edinburgh and 2 in McAllen. And if you're watching us online, we have seen people from Jamaica, from England, from all over. Find me online if you need to learn how to change lifestyle habits. I have online courses. Find me on my website and learn how to empower yourself to take charge of your health and to live a happy, healthier, and longer life. We'll see you next time, same place. Until then, so long.
Thank you.